Good afternoon to everybody. Thank you, Donna, for hosting this talk. It's a pleasure to participate in this EHTEL Symposium 2020. And thank you for the opportunity to share some thoughts about blended healthcare models and how circumstantial may become sustained. So everybody talks about telehealth and digital health. They have become very sexy topics, and probably many of you have already seen this cartoon. After all, it seems that the virus has finally managed to boost digital transformation in health. Everybody is prognosing a very bright future for telehealth. It all of a sudden has become big business. But I must confess I have some doubts, and COVID has certainly dramatically increased interest in telehealth and even forced its adoption. But did it transform the way we organize and provide healthcare? Are we really witnessing a sustained growth of telehealth? So let me please share some of our experience at this. This is where I work. It is the largest private healthcare provider in Portugal. And when COVID struck our country in March, we locked down on the 13th. We implemented teleconsultations at KUF within a week. There was no teleconsultation before. So the adoption by patients and doctors was impressive. Up to 900 teleconsultations a day, more than 1,200 doctors of more than 30 specialties joined. I have to tell you, we suffered an 80% decrease in face-to-face consultations during this lockdown period. And video consultations, on the other hand, rose to a third of our consultation activity. Patients and doctor satisfaction was huge. Patients rated the service 8.7 out of 10 and considered their problem correctly addressed in 93% of cases, which was great. They only felt the need to scheduling a face-to-face meeting in 3% of the cases, and doctors had similar positive perceptions regarding effectiveness. So everybody was going really good for telehealth. But let's see what happened when people got confident again to leave their homes. The number of daily teleconsultations went down to only 200 a day, which is about 2.5% of current consultations. So teleconsultations were directly related to the fear from coronavirus. After all, teleconsultations were only a surrogate for face-to-face consultations that had been temporarily less accessible. And we definitely did not experience real transformation. So what then should be the right drivers for transformation? So, well, I'm convinced those that help to solve our society's structural long-term health challenges. The progressive aging of our population, the so-called silver tsunami, the rise of chronic diseases as a main consumer of our healthcare resources. We are in the midst of a chronic disease pandemic, and of course, the consistent rise of public health expenditures, which threatens our sustainability. So healthcare has definitely to change. It has to change from the episodic care we were used to during the last century, to a model where health is individually managed throughout life. Episodic care is typically reactive. It is focused on acute health events. It is disease-centric. It has been provider-centric. Financing has been mainly per transaction and volume-based. And this might have yielded acceptable results in the past for prevalent disease patterns we found at that time, but it will definitely not succeed in the future. A chronic disease rarely comes alone. Its prevention often involves a change in lifestyle. Close monitoring is needed to prevent decompensation and slow its progression. Follow-up requires interdisciplinary collaboration, tailored solutions, and active involvement of the patient and his or her family. Chronic diseases become increasingly expensive as they progress. So to win this battle, health has to be continuously managed. Healthcare has to be preventive, proactive, personalized, home-centric. Its financing must be oriented at outcomes and must be based on the value it provides to patients and to society. We will not be able to achieve this and make it sustainable without the power of data and technology. That means we must put data, artificial intelligence, omics, IoT, robotics, and of course, telehealth at the service of healthcare. And we have to create a hybrid patient journey, a patient journey where remote touch points like teleconsultations coexist with traditional on-site touch points, where digital touch points like the use of an app for checking symptoms are naturally embedded like human touch points are today. So drivers for choosing what kind of touch point is most appropriate in each moment should be whether outcomes are improved, costs are lowered, patient experience or clinician experience are improved. And this should clearly guide the design and implementation of telehealth services. Telehealth is instrumental, it serves a purpose, the value proposition should be very clear. And this is why we at CUF decided to implement a new and very targeted telehealth services. Since June, we offer a remote first touchpoint in the acute care pathway to our patients. We wanted it highly effective and we achieved it. 89% of our patients have their problems solved and do not need presential care afterwards. However, if there is a need, we refer them to the most adequate and convenient face-to-face care. We have a unique integrated EHR for each patient, so this supports continuity of care. As you can see, patient satisfaction is high, and despite the decrease in our other teleconsultations, this service has been growing. So the digital first model of specialized dermatology care in the Portuguese NHS is another example of meaningful embedded remote care. We unfortunately have an important access problem to specialized dermatology care in Portugal. Unfortunately, there are long waiting lists, and primary care referrals to specialized care are done digitally through dedicated softwares in the system. And since October 2018, referrals from primary care to specialized dermatology care has not only to integrate clinical written information, but also images of the skin lesion. So this is a decree by the Ministry of Health. And the dermatologist will then decide which cases need a face-to-face consultation. They are then scheduled according to their clinical priority. But all those cases where the information received is enough to counsel the primary care physician regarding diagnosis and treatment are handled completely remotely in a store and forward concept. This is convenient for the patient. It is an important contribution to tackle the access problem by using specialists' time in the most efficient way, and it empowers primary care physicians. So if we had more time, I could give you many more examples for telehealth services that improve outcomes, frequently by increasing access. Telehealth services that lower costs, improve patient and clinician experience. There are telemonitoring services for chronic diseases that decrease unplanned hospital admissions, remote diagnostic services like telepathology that enable smaller hospitals to provide high quality care, remote screening for diabetic retinopathy powered by artificial intelligence, highly specialized multidisciplinary teleconsultations that bring best practice to people that do not live near an expertise center. All these examples are part of an integrated hybrid patient journey and change classical healthcare provision. So telehealth should not be a different channel, or not only be a different channel for the same service. It must enable new care models. And the COVID pandemic is a huge opportunity for recreating healthcare. It created widespread awareness among patients, professionals, organizations, and governments. Many of the skeptics, and I'm a physician, so I'm speaking of my colleagues. Many of the skeptics finally tried it, but fear from a virus is not the right drive for real and lasting change. So please let me leave with these three messages. So telehealth is instrumental, it serves a purpose. Telehealth will sustainably grow whenever it enables better outcomes, lowers costs, improves patients and our clinicians' experience. And telehealth will be most successful when meaningfully embedded in a hybrid patient journey. So thank you very much.